if my mom felt like she was a part of her health care and her voice was valued, she would still be here today. September 19, 2020. My mom calls me and says, I'm having chest pains and I'm short of breath. I'm gonna go to the ER. I had just left her a few hours earlier when she had eye surgery. I was a driver. Took her home, she was fine. I told her, Mom, you can't drive. I'm gonna call 911 and I'll be on the way. I called 911 and got from my car actually, got into the car, drove to my mom. When I got there, the ambulance was there and they were working on her. I followed them to the hospital, and little did my mom and I know we would be embarking upon a year of treatment, hospitalizations, rehabs, skilled nursing facilities, home health, dialysis, all of these things that resulted in her declining health as well as her death, ultimately. Let me tell you a little bit about my mom. Linda Diane Gary is her name. I called her Mom. My dad called her Lynn Gary. After he died, I started calling her Lynn Gary too. My mom was about 5 feet tall, is that? Probably 4'11", about 115 pounds. But don't let her small stature fool you, because she was stubborn and strong-willed. Anyone else have a strong-willed parent out there? My mom was. And like most moms and daughters, we had our ups and downs, but one point of contention was always her health. I can just hear her now. Kiva, I don't trust those doctors like you do. They don't care about us. They just want me to take a bunch of meds, and they don't really care how I'm doing. She always felt that way. I heard somebody already say it, that's right. I heard her say that so many times. But I always worried about her. And if I'm honest, I always knew that I would lose my mom to something that was likely preventable. And while I knew I'd always lose my mom, while I always knew I'd likely lose my mom before I left this earth, I didn't expect her to go so young. She was only 68 years old. That's young. Yeah. So, back at the hospital, I was with my mom almost every day over the course of a year to support her. She really relied on me to explain things and bridge the gap with the medical providers, and I was happy to do that. But I wanted to empower her to ask her own questions. And so one day I told her, I said, Mom, when the providers come, when your doctors come, you check out completely. And then you ask me what happened. You should ask them. I want you to hear it from them. I don't mind being here and explaining things, but I want you to ask them because you have the right to know what's going on with you. And so the very next day, when I went to the hospital, they had done rounds a little earlier, and she was so excited to tell me that she listened and she asked questions. And I was so proud of her. You know, when my mom talks about her experience, when she talked about her experiences with her physicians, I never negated what she felt. I just felt like there was a better way. You see, there's a lack of trust in the African American community for medical providers. And with good reason. The Tuskegee experiment started in 1932 and lasted all the way until 1972. 40 years, you guys, 40 years. It is the longest non-scientific experiment in medical history. So we have that. Then we have Henrietta Lacks, who unknowingly donated her cells to medical science in 1972, and she was never compensated, neither was her family. And then we have Serena Williams. Serena was having her daughter at the hospital, and she had a history of blood clots. And she felt that something was wrong. And she talked to the hospital staff, her doctor, everyone, and told them that she felt something was wrong, and they were pretty dismissive of her until she insisted on a test. And when they did that test, they found that she was right, and she had to have emergency surgery, which likely saved her life. You see, the system wasn't meant for us, wasn't meant for people of color. Healthcare disparities, colonialism, access to care are things that make it difficult for people of color to access the medical system. I'd like to give you 3 tips for how to partner with your provider. So tip number 1 would be ask questions. Ask questions. I want to empower you to ask questions. And if you don't understand, ask a second time. Ask a third time. Ask a fourth time. Ask them to explain it to you like your child. Ask them to draw a diagram, whatever it takes for you to get a good understanding. My granny had an experience a few years ago where she went to see her medical provider, and they did labs, gave her the results, and clearly did not explain them or do a great job of answering any of her questions. Or, but again, maybe she didn't ask any questions because she's from that silent generation to where you comply. And there's that hierarchy. So a doctor is smarter, so you're not going to ask questions. And my granny got home and looked at those labs, and she was so upset. Her interpretation was that she had kidney failure, never had problems with the kidneys before, and that she was dying. And I knew that that probably wasn't right, so I went to her house and I looked at the lab. I'm not a physician, but in my understanding, I'm like, I don't think this is what it is. So I called a good friend of mine to have her to explain it to her, and she felt much better. But what if my grandmother had been more empowered to ask questions? She could have asked and gotten a clear understanding at the time of the visit, and not gone home upset, thinking she was dying. Tip number 2, be an advocate for yourself. You are the one who advocates for yourself better than anyone else. And it's important that you do so. Another family member, my great aunt Dorothy. She's my grandmother's sister. I always knew that Aunt Dorothy didn't have kids, obviously, I knew that. And she considered me a daughter. And I remember as an adult, I asked her why she never had any children. And she told me a story that I wasn't prepared for. She told me when she was 19, I don't know, that would have been about 1942 or so. She, and they were from Dallas, she went to what they call the Black Park, which was the basement of the main hospital. And Parkland wasn't even where it's located now, it was somewhere else up on Maple Street. And she was having some pains. They found out that she had a fibroid tumor, just one. And they did a full hysterectomy, robbing her of her fertility. She didn't have an advocate, and she didn't know how to advocate for herself. She wasn't even allowed in the main hospital because she was Black. Be an advocate for yourself. No one else is. We heard about Serena. She was an advocate for herself, and it saved her life. Tip number 3, build a relationship with your provider. Your provider needs to know who you are. Your mom, your daughter, your wife. They need to know your culture and what's important to you. Your beliefs about healing. All of those things are important because they are who you are. So build that relationship with your provider. Does anyone else here hate getting on the scale when you go to the doctor's office? I dread it. So much so that I put off going to see my amazing doctor, Jill Wagner, she's TEDxDeSoto. I put off going to see her because I knew I gained some weight, and I just didn't want to deal with the scale. I didn't want her to tell me that I needed to pay attention to my weight, and I also didn't want to see that sign in her office that says there will be no excuses taken for not working out. And when she came to see me in her office, she said, "What took you so long to come in?" And I said, "Dr. Wagner, I just didn't want to deal with the scale." And she said, "Sweetheart, if your weight is keeping you from taking care of yourself, we just won't weigh you." And she turned to her assistant and said, I don't even remember her name, and she said, "Go ahead and put that in Ms. Harper's chart. Don't weigh her for 6 months." And I looked at her, and of course I started crying. I'm like, oh my goodness, I didn't even know that was an option. So me telling her something that bothered me, she made the change because she is my partner in my healthcare. She made a change that was nothing to her but everything to me. So the relationship is very important. Get to know your provider, show them pictures of your children, things like that. Let them see you as a person. Again, this system was not made for people of color. We have to be proactive in our own health care. My mother is no longer here with us, and she doesn't have that opportunity. But I'm here. I partnered with my healthcare providers. We've been added to more because of my mom's history of heart disease. I met with a cardiologist. I intend to be here, and I do not want her death to be in vain. I challenge you to do the same. Partner with your healthcare provider. Speak up. There are no limits.